Wellness for Life is brought to you by Perham Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hi, I'm David Gothenburg, chiropractor here in Pelican Rapids, and I thought an interesting subject today might be tendonitis. And so if people have heard of tendonitis, what it really is it's either an inflammation or an irritation of a thick cord that attaches the muscle to a bone. And some of the more common symptoms might be localized pain or swelling, or tendonitis might start to limit the flexibility or movement of a joint. Causes vary from things like repetition or minor impact, a minor injury. It might have a lot to do with the posture or the alignment of a joint. And then again, it might have to do with an abnormal position or placement of a bone or joint. For example, things like differences in leg length or underlying arthritis. These things can all start to cause irritation on the supporting connective tissue. The most common sites can be found in our extremities, like the knee, hip, elbow, and shoulder. Maybe you've heard of the word tennis elbow or golfer's elbow. In fact, sometimes when the condition is allowed to occupy the shoulder too long, it actually forms an adhesion, and this is when doctors use the word frozen shoulder. And so what we try to encourage people that we come into contact with is, if you begin to have pain in a joint or notice swelling, or when moving a joint you begin to hear a crepitus or a grinding-like sound, that is the best time to seek intervention. And a lot of things that you can do at home is, for example, is certainly stop the repetitive activity. Icing is excellent. Resting the area and bracing the joints. So there are different types of braces or straps that you can find that help support the joint. It's still a good idea to visit with a doctor or a chiropractor as far as how to place the band or strap so it's not too tight and in the right place. So let's say you choose to seek some type of a care. Medically, what appears to me is that the options a lot of time are rest, something for pain, and what seems to be very popular today is cortisone, which I believe that if applied or received more than 1 or 2 times is actually caustic and lengthens the duration of the problem. People may choose to see physical therapists who use different types of therapies to try to alleviate pain. Chiropractors, I think, while we can provide these same services, we also take into consideration the effects of joints above and below the injured site as to how do they affect the pain. For example, with the hip, we may look at differences in leg length, and we might not only look at the knee, the foot and ankle, but also the low back and pelvis. Definitely for the shoulder, other than just simply treating the shoulder, I would look at the elbow, the position of the shoulder blade, the sternoclavicular joint, and the AC joint. So I think rather than just doing something to provide relief, that in the very end we want to improve posture, structure, and alignment. And I think this is when people get well very quickly. In the event that you're having pain or have heard that word tendonitis, feel free to contact us here in Pelican Rapids. Maybe just advice on how to tape a joint or brace a joint so it's the most effective. Thank you.
Coming up on Wellness for Life.
I'm Dr. Joy Quitberg, an optometrist at Sanford in Detroit Lakes, and today I'm going to talk about cataracts. To start off with cataracts, let's talk about where a cataract is found. It's actually found on the inside part of your eye on the lens. So it's right behind the iris, which is our colored part of our eye. Right behind there is the lens. And a cataract is actually described as an opaque or clouding of the lens. So instead of having the nice clear lens, it can become cloudy, or it can also have this type of description where we've got spoking from the periphery and going into the center of our vision. Ways to know that you may have a cataract would include blurry vision during the daytime, maybe some blurriness and some glare during nighttime vision as well. Also, you can start to notice that there is a dimming of colors. They don't appear nearly as bright as they once did. In order to have a cataract diagnosed, do make sure that you come in to have an eye exam where we take a thorough history and see if you note any of these changes. Also, a dilated eye exam in order for us to take a really good look at the lens on the inside part of our eye. With a cataract, typically they do start as we get a bit older. Also, if a person is diabetic or a smoker, the cataracts can advance at a more rapid pace. In order to treat a cataract, if it's in just the beginning stages, what we would do is maybe just monitor it or possibly do a new glasses prescription to make things a bit crisper and clearer. Once a cataract becomes mature or bad enough that we would need to do something else, a person would see an ophthalmologist to have cataract surgery. What that would include is the cataract basically becomes dense on the inside part of our eye, so the surgeon makes an incision right here next to the colored part of our eye, and through the cornea they insert a probe, take out the cataract, and then put in a nice new clear lens right on the inside part of the eye. We do recommend eye exams every 1 to 2 years, so we can evaluate for that. Once a person does have cataract surgery, assuming everything does go well, ideally what happens is you get nice and clear distance vision. However, a person can need reading glasses while they look up close. Another option is we do have a multifocal lens implant that can be done, which typically will eliminate glasses for distance and for near. If you are concerned or have any questions about cataracts or an eye exam, you can always give us a call here. We are able to do the eye exam, the dilated eye exam, and also we can set you up to see an ophthalmologist. We have Dr. Steve Anderson, who does cataract surgery here at Detroit Lakes, our same-day surgery center. Also, we're available to do the pre-op and the post-op care here at Detroit Lakes. If you have any questions or are concerned about this, you can call our clinic in Detroit Lakes and set up an appointment.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Sanford Health Clinic and Same-Day Surgery Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,